This was an interesting moment for me earlier. Pastor came over and said, "This is who's doing our community awareness spot." I said, "Okay." So in my head, the face looks familiar, but I'm like, I don't even remember his name. So, please, introduce yourself to us.
Good afternoon, everyone. My name is Marlon Bridgman.
Okay, and what do you do?
What do I do? I am a mental health nurse by background, and currently I'm a lecturer with the University of Middlesex on the pre-registration mental health nursing course.
Okay, there was a lot there.
Yeah.
The key thing there was mental health.
Yes.
Now, I work in a sixth form college and I do some work with ADRA's organization, I Am Urban. And one of our 5 areas is mental health. So, for my benefit and everyone else's, can you give us a bit of an idea about what mental health is?
Okay, what is mental health? Maybe I can get you and maybe the congregation to sort of help us think a bit more about mental health. Now, mental health is very broad and deep, so we're just going to scratch the surface in the next few minutes. So, to you, Abby, and to you all as well, when you hear the term mental health, what comes to mind? Brainstorm, just quickly. What comes to mind? Crazy. What else? Anyone?
Mental health, what do we think of?
Straight, what comes to your mind? Depression, sad. Did I hear schizophrenia? Craziness. Anything else? Loneliness. Mad. Anything else? Suicide, yep. Depression. Anxiety. Anything else?
Resilience.
Resilience, okay.
Any others?
Okay, any other thing? Psycho, thank you, yep. What else? Anything else comes to mind when we hear the term mental health? Sorry, I didn't hear that. Keeping your jobs. Problems with keeping your jobs, okay? Is that it? Have we exhausted?
Abuse.
Emotional. Okay, very good. Okay, that's it. Okay, let me ask you another question. When you hear the term physical illness, what comes to mind?
Doctors.
Doctors. What?
Motionless.
Emotions. Okay. Pain. Physical illness, what comes to mind straight away? Well-being. Anything else? Physical illness.
Medication.
Medication. Depression again. Anything else? Physical illness? Anxiety. Okay. Arthritis, thank you.
Diabetes.
Diabetes, yep. Anxiousness. Come on, physical illness. Cancer. Hospital stay. Anything else? Physical illness? Is that it? See your hand at the back. Okay. I'll ask you another question. When we hear the term physical health, what comes to mind?
A good BMI.
A good BMI, okay. Fitness, lovely. Physical health, what comes to mind? Shout it out. Shout, shout. Yeah. Did someone say sleep? Yep, good. Balanced diet, good. Exercise, superb. Anything else? Physical health? Insomnia. Okay, that's probably more physical. You need, yeah, physical health. Okay, probably, okay, so we need to sleep. We need to sleep
Good water
properly.
intake. A good water intake.
Yep, water intake, be hydrated, diet, exercise, I heard. Anything else? Okay, so you're looking at your trying to lose weight to be healthy. Okay, anything else when we hear the term physical health? Personal hygiene? Okay.
But what does this really all have to do with mental health?
We're coming to that now. Okay, so I've asked you about mental health. I've asked you about physical illness, physical health. What's missing? Okay, what comes to your mind when you hear the term mental illness? Anyone? Mental illness? What comes to mind? Schizophrenia,
Body dysmorphia.
body dysmorphia. CBT, behavioral therapy, cognitive behavioral therapy. Okay. Anything else comes to mind when we hear the term mental illness? Or have we exhausted what? We've said everything when we spoke about what?
Mental health.
Mental health. Can you see where I'm going with this? Can anyone see where I'm going with this?
I think I get it.
You think you get it? Okay, try.
Shall I kind of work
Okay,
out
go
my
on then.
roadmap?
Yeah, go on.
So you started with mental health, and then you spoke about physical health, physical illness,
Yeah.
yeah? And then physical health, and then mental illness. Am I right to say that often we associate mental illness with mental health,
Yes.
whereas we don't always associate physical health with physical illness? We would never use the two as interchangeable.
Okay. Yes, excellent, very good. So we see from our explanation that there was a clear demarcation between physical health and physical illness. When it comes to mental health, we just roll everything into one. We need to realize that just as there's physical health, there's mental health. Just as there's physical illness, there's mental illness. And we need to look after our mental health, just as we would look after our physical health. Okay, so who could be brave enough to give me a definition of mental health? Probably. Anyone wants to try a definition of mental health? Doesn't have to be textbook, just
I think as the expert, they're really looking to you for the
looking to
answer.
me. Okay. I'm just going to, in a nutshell, okay? So our mental health really is about our emotional and psychological well-being, which allows us to do our normal everyday stuff and cope with stress and be productive and be a valued member in our community.
So, can you give me three maybe nuggets or three tips that I can use to check up on or maintain my mental health?
Okay. Three things. Firstly, I would say, if you're struggling, seek help. Don't suffer in silence. As a tutor, I tell my students, when it comes to assignment time, if you need help, come and see one of the lecturers. Don't suffer in silence, fail, and then come to us. Come from the beginning. If you're struggling, seek help. That would be my first nugget. Secondly, just as we have discovered that there's physical health and mental health, and we look after our physical health, we need to look after our mental health. Our physical health is associated with our mental health. So if we look after our physical health and do some of the things that we were talking about, good diet, exercise, sleep, these things would actually promote good mental health as well. And my last tip would be to maintain healthy relationships. Firstly, our relationship with God. Spend time with God, get to know Him. Yep, we need to maintain that relationship. And our relationship with each other. You know, sometimes we may be down and out, we may not want to socialize as we normally do. This is the time we need to sort of force ourselves, talk to people, meet friends, speak to them. Yep, so those would be my 3 tips.
Maybe I don't struggle with mental illness, but how can I support someone who does?
Okay. It's really simple, and it starts with L. Anyone wants to guess what that might be? Listen. Yeah. Yep, listen, and listen non-judgmentally. Do you know what that means? Yep, we don't judge. We listen, and we listen to as much as the person wants to say or as little as the person wants to say. Yep, just listen to the person and be open-minded and be able to direct that person to seek help. Sort of, we say signpost for help. If you don't have to be a professional in mental health, you don't have to know anything about mental health, mental illness to listen. Yep, we can all do it. Listen. If we don't know who to go to, in church we have elders, we have the pastor. Direct the person to the elders, the pastor, and they would be able to signpost further on.
Thank you so very much. So, just a plenary, because this is what we do in schools. We provide a plenary at the end. The three tips once again.
Seek help.
Yep.
Maintain your physical health.
Yep.
And look after your relationships.
Lovely. Thank you very much, guys.